Hi everyone, welcome back to my YouTube channel. Today we are going to talk about Vomer, and here at the side you can see the diagrammatic representation of skull with the highlighted part that is Vomer. So let's start our topic with introduction. Vomer is unpaired, thin, flat bone located in the midline of nasal cavity. It forms the posterior inferior part of nasal septum as you can see here in the diagram, just dividing the nasal chamber into left half and right half. Though modest in size, it is critical for proper airflow, nasal structure, and facial symmetry. Talking about its location and orientation, it sits vertically in the mid-sagittal plane of facial skeleton as you can see here in diagram. It lies just below the perpendicular plate of ethmoid bone and behind the cartilaginous part of nasal septum. It forms the lower and back portion of nasal septum. Talking about borders and articulation, the vomer articulates with six bone and septal cartilage. These bones include superior border that divides it into two allied that flank the sphenoid bones rostrum. These group embrace the sphenoid, securing the vomer to the cranial bone. Second border, it has an inferior border that rests on hard palate from the maxilla and palatine bone. Now let's talk about its anterior border that slopes upward and forward that articulates with the perpendicular plate of ethmoid bone and septal cartilage of nose. Then it has posterior border that is free or unattached, forming the posterior edge of nasal septum. It separates the coronae, that is the pair posterior opening of nasal cavity. Talking about surface and shape, it has two flat surfaces that are slightly concave. These surfaces form the medial wall of posterior nasal passage. Development and ossification. It ossifies from two lateral centers that fuse in the midline during early childhood. It is derived from the cartilaginous nasal capsule that is the part of embryonic development. Functional significance. Supports the nasal septum as it stabilizes airflow between the left and right nasal passage. Contributes to the facial symmetry and the internal structure of nose. It plays a role in voice by helping define the nasal cavity shape. Clinical significance. Deviated nasal septum. When the vomer is displaced or misaligned, it can block airflow and cause nasal obstruction, snoring, or chronic sinus issue. Surgical correction or septoplasty. Procedures to straighten a deviated septum often involve partial reshaping or removal of the vomer. Third significance is trauma. Facial injuries may fracture or displace the vomer, affecting the breathing and symmetry. Now let's talk about conclusion of this lecture video. Though often hidden from sight, the vomer provides structural backbone to one of our most important facial features, that is the nose. It ensures balanced air movement, helps define nasal passage, and hold its own among the most prominent bones of the face. And this was all about this vomer. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.